Our main goal was to change the disastrous lockdown policies that we've been seeing used to address the epidemic. And we've all of us forecasted that there would be a second wave upcoming in the fall. And what we were afraid of, and which actually came to pass, is that countries around the world would rely on lockdown as opposed to more tried and true pandemic approaches to address the problem. So our goal was to change that policy, to tell people that there was an alternative, focused protection of the vulnerable, over and above lockdown, which has basically failed to protect the vulnerable and also caused enormous collateral harm.
Now, you're a professor of medicine at Stanford. You got a PhD in economics from Stanford. You got 4 degrees from Stanford. You've published dozens and dozens of articles in peer-reviewed scientific journals. And your fellow co-authors of the Great Barrington Declaration are equally distinguished. And yet the response to what you did from academic colleagues and the broader scientific community, there was tremendous pushback, and worse, wasn't there?
There really was, and I was actually frankly surprised by that. I did expect some pushback, but what I more broadly expected was engagement by public health officials, by the scientific community at large, to think about mechanisms to protect the vulnerable. I mean, that's just such a standard part of public health. You identify a vulnerable population and you think of creative ways to protect them, to give them tools so that they can avoid disease, that can stay in good health. That is standard public health. And instead of that engagement, we got some, but for the large part, instead of that engagement, what we got was smearing, mischaracterization. I mean, Dr. Tony Fauci of the National Institute of Health, he actually said that we were in favor of a let it rip strategy, which is the very opposite of the strategy we were proposing. We don't want to let it rip through the population. What we want is focused protection of the vulnerable.
What do you think future historians will say, Dr. Bhattacharya, when they look back and they see people like you being chided, insulted, smeared? You can look after yourself, of course, but the throwing out of decades, centuries even, of scientific progress and endeavour, reaching for basically a medieval full lockdown solution.
Yeah, I doubt future historians will have much to say about me in particular, but I do think that future historians will look back in this and say this was the single biggest public health mistake possibly in all history in terms of the scope of the harm that it's caused. Every single poor person on the face of the earth has faced some harm, sometimes catastrophic harm, from this lockdown policy. You know, the UN in April of last year estimated that 130 million people around the world would face starvation as a consequence of the lockdowns. Hundreds of thousands of people would die from tuberculosis because they didn't receive basic treatments that would have saved their lives. That's in developing world. The UN in March of this year estimated in South Asia alone, 228,000 children have died from starvation and missed medical care because of the lockdowns there. In developed countries, we have similar problems, although maybe not quite the same scale. Right? So women this year will come in with late-stage breast cancer that should have been diagnosed last year, and they'll die from breast cancer that they should have survived. Men and women together will die from colon cancer that should have been picked up last year. Diabetics will have kidneys fail that should have been addressed during the previous years. We're going to have an enormous after effect of these lockdowns. It's not simply one. I mean, and it's very, very simple. You can't think about public health as if it were just one thing. Health is a multifaceted thing, and public health should focus on all the facets of health. I think the harms of the lockdown are orders of magnitude worse than whatever we putatively gained from the lockdowns in terms of virus control, which I think is not very much. Lockdown is trickle-down epidemiology. It's essentially focused protection of the rich. It's really incredible to me to watch the failure of this strategy so evident, and yet much of the scientific community remains attached to it. It's failed everywhere it's been tried, and it's caused enormous harm. This was the single biggest public health mistake possibly in all history.